Hello everyone, I am Dr. Suma Nair. So let's start. So here comes our first question. The class 3 amalgam restoration in canines, so which of the following matrix band will be useful? Mylar strip, copper band, Toffer-Meyer band, or the S-shaped band? The answer is S-shaped band. The mylar strip is made of the DuPont, that is 0.002 gauge, 60 mm of thickness. It has smooth finished edges for the patient's comfort. They resist the various solvents which are present in the oral cavity, and they are very strong, that is, it will not stretch, curl or break. It prevents the composites from adhering onto the adjacent tooth surfaces, and when used in labial surface build-ups, it helps in achieving the desired aesthetic anatomic contour and excellent labial surface finish. The Toffer-Meyer matrix system, which is also called as the universal matrix system, is used in class 2 type of restorations. The primary function of it is to restore the anatomic proximal contours and the contact areas of a tooth. Moving on to our next question, the bacteria in pericoronitis is Staphylococcus, bactericides or Famulus? The answer is bactericides. Pericoronitis is an inflammation of the soft tissue surrounding the crown of a partially erupted tooth, including the gingiva and the dental follicle. Now, the soft tissue which surrounds a partially erupted crown is also called as the operculum. So treatment is depending upon the severity of the conditions. In very mild cases, the patient is advised to take the anti-inflammatory and antibiotics and also to do the salt water rinse. In moderate cases, minor oral surgery to remove the overlapping gingival tissue, which is also called as the operculectomy, is advised. And in severe cases, the removal or the extraction of the third molar is a proper treatment. So here is a diagram which I have drawn for you all to make you understand very clear about this concept. The red color portion is an inflamed gingival tissue or the inflamed gums, which is called as the operculum, and the yellow color is the food debris which have got accumulated, and this will eventually lead to the bacterial infections and pericoronitis. So here is a clinical feature as in how and what can we see actually in a patient's mouth. So the green arrow which I have shown in this diagram is the operculum. Moving on to our next question, the fluoride amount in water should be 0.2 to 0.5 mg per L, 1 to 5 mg per L, 1 to 2 mg per L, or 0.1 to 0.2 mg per L. The answer is 1 to 2 mg per L. The maximum amount should be 1.5 mg per L. The fluoride reduces caries activity by antimicrobial activity, that is, it reduces the bacterial adhesion and carbohydrate storage and enhances the remineralization of the non-cavitated carious lesions. It enhances the precipitation of insoluble fluoroapatite crystals into the tooth surface. The next question is, tuck back of GP is due to the tensile strength, retention in apical 1/3, condensation or elasticity. The answer is tensile strength. The tuck back is apical seal fit of the master cone. The obturation material should provide a tight apical, that is a fluid-free seal, to prevent the entry of various oral fluids into the periapical areas. Moving on to our next question. During endo, the patient complains of pain with POP positive and no fluid extrusion. So what do you suspect in the situation? Apical periodontitis, secondary apical periodontitis, over-instrumentation or over-medication? The answer is over-instrumentation. It happens due to the instruments or irrigants or debris which are being forced into the apical tissue. Now, what is apical periodontitis? It's an inflammatory lesion in the periodontal tissues that is caused mostly by the bacterial elements which are derived from the infected root canal system of a particular tooth. Whereas in a non-treated tooth, the apical periodontitis is a defensive response to a primary infection in a necrotic pulp. Whereas a secondary apical periodontitis results from a persistent infection which comes from the incorrectly treated root canals. So thank you my dear friends for watching today's video. If you have enjoyed watching my video, please do not forget to like and share all my videos to your friends. So see you next time. Till then, take care. Bye.